San Diego County jails are facing a whole new set of challenges as they absorb thousands of offenders who previously would have been housed in the state's prisons. One of the side effects of this is that inmates are often in jail much longer and their health care needs are much more extensive. Dr. Alfred A. Joshua has taken on the job of Chief Medical Officer with the Sheriff's Department. Thanks so much for joining us.
Thank you for having me here.
So you've been in this position for only about 3 months. Tell us, what is the main challenge facing the Sheriff's Department in terms of health care for the inmates right now?
So it really is changing the paradigm of what the jails are used to in terms of medical care. Prior to AB 109, or the Public Safety Realignment, inmates would be housed in the jails for about a year. If they needed to be there longer than a year, they could be transferred to the prison system. Now, non-serious, non-violent, non-sex offenders are now staying in our jails, sometimes for as long as over 10 years. What this really does is, we were traditionally set up to take care of inmates for urgent care issues, urgent hospitalizations, and if they had chronic issues like diabetes, high blood pressure, before they came to jail, we would continue that same treatment. Now we have to do a lot more preventative care, chronic disease management, and also look for ways to try and get them successfully transitioned back into the community and reduce the recidivism rate.
So one of the reasons that 109, the whole realignment thing happened, was because there wasn't adequate access to health care in the state prisons. What's the wait time now for inmates in the jails? I mean, aren't we facing the same problem?
So the jails, especially in San Diego County, work fairly efficiently. We actually have standardized a lot of our processes in terms of triaging and acuity so that the patients that are most sick are seen in a very timely manner. And we've actually, for the non-urgent complaints, they're more to a community standard, but it's still fairly expedited.
Are there some conditions that people who are in jail, inmates, are more likely to have than the general population?
Yes. So certain issues such as mental health issues are pretty prevalent in the jail system. In our jails, 28% of our inmates are on psychotropic medications. In terms of substance abuse, that's a big issue with both drugs and alcohol. Almost 2/3 of our inmates have either charges or are directly involved, either drugs and alcohol. So it's a huge burden on specifically for the inmate population.
So are you expanding the drug and alcohol treatment facilities?
So we're looking at a very comprehensive model, because we feel that, in order to keep the inmates healthy, we have to address all of their issues in a very comprehensive manner. So we're looking at it from the medical issues, like if they have high blood pressure, diabetes, but also looking at it from substance abuse. How do we give them coping mechanisms so that they won't recidivate based on going back to drugs and alcohol? And with their mental health, can we manage and stabilize them so that they're going to be successful when they are released from jail?
And that, of course, is a very important point, because with the whole success of this will depend on not having a lot of people recidivate, come back to the prison. How are you following up when they leave the prison in terms of follow-up health care?
So really our whole system is, we're looking at a very comprehensive approach. So we've tried to standardize our processes. So that's where it first starts with our medication formularies. We've standardized how medications are given. Are they safe? Are they effective? Are patients going to still comply with them when they leave? We've also looked at clinical pathways in order, how do we appropriately manage their high blood pressure, diabetes? Then we go into the community and basically say, who can we partner with in terms of our health systems, with our community providers, and then also with, how can we share information with the Health Information Exchange, where we can actually put patients on simplified regimens they're going to follow, be able to be seen at providers in the community, and be able to be successfully transitioned back in there. So we're building all of these processes as we speak.
And then you have the inmates who are staying there for long periods of time and maybe getting older and have chronic conditions. I mean, what kind of facilities are you having to add, really, to your whole list of facilities?
So historically, the jails are not built for the infrastructure for long periods of time. But what we've really tried to do is, for these inmates, we've identified who needs preventative care, such as immunizations and those kinds of issues and screening tests, as well as chronic disease management, diabetes, high blood pressure, oncology care. And we're really building these programs, such as with the clinical pathways, to really say, how can we appropriately manage these people throughout the length that they'll be with the Sheriff's Department.
And Dr. Joshua, what is this going to cost the county?
Well, it's definitely going to consume more resources, but the Sheriff's Department, led by Sheriff Gore, and really the talented leadership team that he has, all the way to the deputies and medical staff, are working countless hours in order to actually get this as cost-effective as possible.
Do you have an estimate?
So last year, our medical budget was about $66 million, and it has gone up a couple of $1 million specifically related to AB 109.
And how will you know that this new model you're building is successful?
So we're right now also building the metrics to really show if this is successful. And one of the big metrics will be the recidivism rate, as well as are we transitioning these people back successfully.
Great. Dr. Alfred Joshua, thank you so much for joining us.
Thank you for having me.